I do for every keloid, but it's just a quick few seconds. When I see a bit of frost, I will just run through the cryo only. The main purpose is to soften the keloid, and also it's sort of like an anesthesia, a temporarily anesthesia for the patients. Of course, there are some studies that show that it helps to reduce down the volume of whatever you're going to deliver, you're going to inject into the keloids. Yeah. Anyone? What about you all? Do you all do cryo for every keloids that you see prior to injection?
I don't do for everybody. It's just that sometimes the very big ones, then sometimes I do, yeah.
Yeah, I think for some patients, I do the cryotherapy as well.
I also feel like it's like a feel-good factor for the patients, you know. It's like, you know, they get the cold sensation. It's like somehow my patients just love to do it. Special service for the patient.
I usually just use topical anesthetic if the patient is very sensitive. I put EMLA, they go to the clinic 1 hour before. Prilocaine topical, and then
I use the BLT
after
as well.
that, exactly, and then I do the injection after 1 hour. But I haven't tried using the local anesthetic. I suppose it makes sense so that it will be a comfortable injection also.
Because I'm sure you've come across patients that have gone to other doctors, many doctors, and they are traumatized by the injection pain, right? Oh no, I don't want, you know. So I think there's something that extra that we can offer. So
well, I have to say, people under your service are very lucky, because in Taiwan we inject each case, charge about $5 to $7 only. So the patient was on the long line, so we didn't offer it. And otherwise, I just only provided the packing, ice packing, about 30 seconds to 1 minute, and then followed by injection. And you can inject 2 or 3 shots and then repack, ice packing again. So that's what I'm doing. Yeah. Otherwise, patient probably will refuse to do that. And regarding the use of the 5-FU, I usually mix with 1/5 5-FU, 1/5 steroid, and 3/5 with lidocaine, and then actually I'm currently doing intra-individual comparison for my patient, and I found that the scar or keloid on the face and the mandible area responds well compared to those on the rest of the area, for example, the arms and the forehead. I'm guessing, I guess that's because of the muscle activity, or the muscle mass is less on the face and the mandible. So probably you can reduce the skin tension more significantly. And so my patient, for example, one case is on the mandibular area, keloid on the mandibular area, and I inject and observe 2 months, and the patient reported that the response.
I agree, Peter, because I think if you think about the physiology of the scar, and we were using the intralesional steroid to decrease the fibroblasts on that area, to decrease also the inflammation. If you inject it underneath the scar, then you're going to hit the subcutaneous layer and you're going to cause fat atrophy. But if you inject it into the lesion, which is what we do, then you're addressing exactly the layer that you need to treat. So I also do the same thing. I tend to inject in a retrograde manner, because if you're trying to push against the fibroblasts, it tends to be more painful for the patient. So retrograde is really less painful for them.
Yeah, Casey? Sorry.
I think any injection outside the keloid, I would call it extravasation. So that will result in the hypopigmentation, and then this surrounding skin atrophy, and sometimes we see the telangiectasia growing out. I would call it a poor skill. So
I'm going to ask you one question, Warapong, on laser drug delivery. We see that a lot of people apply transaminase acid after pigment laser. be it pico or resurfacing, do you think it works? Do you think that the stratum corneum is weakened enough for the transmanic acid to go in?
Actually, we did a study by using fractional erbium assisted tranexamic acid delivery for treatment of melasma. And this is a split phase study. And we found that the side that we use tranexamic acid work better than the side that we treat it with laser alone. This is what we found, but we haven't published that study yet. But as I mentioned earlier, fractional laser assisted drug delivery is not easy. It's not just you use any energy to drill a hole and you can put any kind of medication inside. Sometimes that medication may not go in at all.